The Global Leaders Network, an initiative founded by South African President Cyril Ramaphosa, took center stage during the 39th African Union Summit in Addis Ababa. Now, while the official AU theme for 2026 focuses on water security and sanitation, the GLN hosted high-level side events specifically aimed at securing the health of women, children and adolescents across the continent. Let's unpack this further with Health Minister Dr Aaron Motsoaledi. Very good afternoon to you. Minister, thank you very much for joining us. The GLN is supported by the Partnership for Maternal, Newborn and Child Health Secretariat and the South African Presidency. Can you provide a line item breakdown of how much of South Africa's national health budget is being diverted to fund the operations?
Well, it is actually the other way around. There is a partnership called PMNCH. It's an old partnership. It means Partnership for Maternal, Newborn, Child and Adolescent Health, so as to promote the health of mothers, newborns, children and adolescents, because they are a very vulnerable group. That partnership is chaired by the former Prime Minister of New Zealand, Her Right Honourable Helen Clark. But then it was recognized that many heads of states do not take the issues of women, children, and adolescents very seriously. You are aware that they are the most vulnerable and the poorest. And so they realize that many governments do not appreciate them and they don't prioritize them. For that reason, President Ramaphosa was asked to chair what they call a Global Leaders Network, a network of global leaders, there are 11 now, who will be promoting this issue of maternal, newborn, child and adolescent health. And as I'm saying, that network has now got 11 leaders who are in it, and every year they are mobilizing them. So the network itself is not really, doesn't really need funding. It just means heads of states need to come together, whether it is during the United Nations General Assembly, or is during the AU, or even Davos, the World Economic Forum. The heads of states need to come together to talk about these issues. So today it was the same. It was the same because we are at the AU meeting. Many heads of states are here. So they come together to talk about maternal and child and newborn issues.
And Minister, then these states that are involved in the GLN, what kind of mechanisms are you going to be using for political accountability in ensuring that young women as well as children are safe?
Well, the network is, as I'm saying, is just to encourage leaders. There's no accountability. Accountability is their own political consciousness. The network is to bring it to their attention and for them to be aware. Maybe let me tell you exactly, to give you an example of how important is it to have the network of leaders. In 2010, Yvonne Shaka led a team of women because she was, she's usually the ambassador of most of these things, malaria, newborn children, women issues. As an ambassador, she was invited to address heads of states at AU in 2010 were in Uganda. When they were introduced, one head of states, who our own name, and unfortunately is late, was very angry. He said, look, we are here to discuss very important state issues, very, very important issues of the state. And you want us to waste time to listen to breastfeeding. He called the whole concept of the health of mothers, children, and adolescents as breastfeeding. Sure. That's how we undermined it. And of course, Yvonne Shaka was very sharp. She said, Mr. President, if your mother did not actually breastfeed you, you would not have been head of state. You wouldn't have been there where you are if your mother did not take care of you. So I'm just trying to give this to outline how important is it for the heads of states to understand issues pertaining to women, children, newborns, and adolescents?
I mean, that's such a jarring example that you just gave us, Minister, because I think it just does give us a glimpse into how unseriously then heads of states take the mortality of children and women. What does this encouragement that you speak of look like then?
It is changing, I can assure you. It is changing because many heads of states, parliamentarians speak about these issues. In simple language, Nompumelelo, I mean, if the partnership for maternal, child, newborn and adolescent health, if this institution was not born, and if the Global Leaders Network, as chaired by President Ramaphosa, did not come into being, things could have been worse than they are now. Now, many heads of states are now able to appreciate the issues of maternal mortality. I was very happy this time around because they were saying this is no longer about health. It's also about economies. It's also development of countries. And so when you link them that way, they start understanding that these issues are very important. They are not just what you can just dismiss as breastfeeding.
And let's talk about how then South Africa intends to use South Africa in particular as a shining example to the rest of the states in ensuring that maternal mortality is taken seriously.
Well, I'll give you several examples, Nompumelelo. You may remember that by 2010, maternal mortality in South Africa was as high as 240 per every 100,000 live births. In other words, out of every 100,000 live births, we used to lose 240 women. And it was mostly because of HIV and AIDS. We launched the world's biggest HIV counseling, testing, and treatment campaign. And 15 years later, the maternal mortality is down to below 100. It came down dramatically because of that campaign we have launched. But also, we have launched many other campaigns like Mom Connect, where we connect women who are pregnant for their antenatal issues. They are connected electronically. They can ask questions. They can be advised. And when the children are born, they can be advised about immunization, breastfeeding, etc., etc. Since we started that, 5 million pregnant women have been connected, and it started around about 2014. But also you are aware that we are the first country on the continent that launched the HPV vaccine. By now, 6 million schoolgirls between the age of 9 and 15 have been vaccinated to protect them from developing the second killer of women, in terms of cervical cancer, cancer of the cervix or the neck of the womb, which is number 2 killer after breast cancer. We've been immunizing women. We are now, this year, as the president said in the State of the Nation address, we are going to launch a campaign to eradicate that type of cancer. So there are many issues that we are doing to safeguard the life of children.
Finally, Minister, just very quickly, the delays that we are seeing, the legal delays that we're seeing in the implementation of NHI will, I suppose, derail some of these efforts that you are telling us about in terms of maternal mortality. What are we going to do with regards to that?
Yeah, maybe you raised a very important question because I forgot it. That as part of this program to safeguard the lives of women, children, and adolescents, it was also emphasized that we need to accelerate a move towards universal health coverage. Universal health coverage, which we call NHI in South Africa. And they said the main reason why universal health coverage is very necessary when it comes to safeguarding the lives of women and children is because, according to figures from the World Health Organization, Africa, the continent of Africa, is the only one where an overwhelming majority of people, in order to get health care, they have to pay cash, what is called out-of-pocket or cash for their health. And we know if health is determined by cash or is determined by wealth, then the people who will suffer the most in any continent or in any part of the world will be women, children, and adolescents, because these are the people who don't have money. I'm sure you understand what I mean. In any community around the world, people who are poor, are the poorest, do not have resources, do not have money, are women, are children, are adolescents. So if health is bought with money, they are the ones who will suffer. And that's why the concept of universal health coverage is so important. It is a great pity, and I've mentioned it in the meeting, that in South Africa, it is now being subjected to court cases, meaning, yes, it will definitely delay the acquisition of better health in the lives of women, children, and adolescents.
Dr. Aaron Motsoaledi, thank you very much for your time.
Thank you.
More news after the breaks.